Again, my name is NATALIYA KOVALCHUK. I'm a clinical professor at Stanford Radiation Oncology, and I am a co-founder and president of Help Ukraine Group. I'm also a member of UA-MAD. So I'll be giving a talk on a collaborative project of UA-MAD organizing observerships abroad. So I have no conflicts of interest to disclose. So UA-MAD is a coalition of partners with the core mission to support and expand the capacity of Ukrainian healthcare during the war. For this particular project of observerships, we got together the coalition of healthcare professionals across various institutions in the US, also in Australia and Ukraine. So you could see here representatives from Harvard, Stanford, Yale, National Cancer Institute in Kyiv, from Northwestern University, University of Oklahoma, and others. So we got together to describe the work we've been doing individually as NGOs. UA-MAD got formed at the end of 2024, but we started our observerships projects much earlier than that. Our first observers came to US in August 2022. In fact, I remember the conversations we had with Nelia Melnichuk about how to start this project, how long the observership should be, how do we deal with visa, all this logistics. And the first observers came to Stanford, and since then, collaboratively, collectively, we organized more than 400 observerships abroad, various countries. So we decided to describe this work and show the outcomes. We ran the cross-sectional cohort study of the survey evaluating 263 observerships abroad, conducted 2022 to 24 across US, Canada, Europe, and Australia. This was a questionnaire of 23 questions asking knowledge gain, clinical impact, dissemination, challenges, satisfaction, and our outcome measures were success score and satisfaction. And the way we define success score, and that can be defined various ways, but the way we did it, it was, did the observers implemented new procedures coming back home, and did they disseminate the knowledge? We also tracked separately peer-reviewed publications. So we had 128 respondents, and they participated in 138 observerships abroad. They were from 45 Ukrainian institutions, and they were hosted by 27 international institutions, which is quite an amazing outreach. Their median age was 34 years, and it was great to see the equal distribution of gender. So here you could see the professions. So the most common one were surgeons, also radiation oncologists, anesthesiologists. The observership length was a median 4 weeks, and most of them, 92%, completed one observership, and 3/4 of the observers actually attended professional conference, and that became a very important factor of the success and measures of success. The observership institutions, you could see the list here. The most common one was Mass General, so thank you so much for Heal Ukraine Group and GMKA for organizing so many of them here in Boston. Then there was Stanford, Yale, Northwestern, University of Oklahoma. So the results, the respondents changed the perception of how to practice medicine, and it was overwhelming majority. Around 93% of them said that they changed the perception, and that's a very strong indicator. 87%, 82% learned new procedures. 28% they started new project outside of practice in Ukraine. And 76% implemented these new procedures back home. So we considered it very successful. There were some barriers in implementation of new procedures coming back home. Obviously, lack of material resources, lack of human resources, but we were happy to see that there were lower indicators for lack of support, resistance from colleagues or leadership. So that shows that the system is changing, and the healthcare system in Ukraine is receptive of change. Knowledge dissemination by observers was overwhelming. Informal training of colleagues, 67%. Prepared presentation for colleagues in institution, 66%. And also a prepared presentation national conferences, around 1/3 of the respondents. Our success scores was 6.5 out of 10, satisfaction 9.3 out of 10. Satisfaction was high among different specialties, but the most successful specialties, what we found, were surgeons, a medical oncologist, anesthesiologist, radiation oncologist. What we also found that the factors associated with success were larger experience, more than 7 years. Sometimes we think we organize observership for young generation, very young doctors without experience that would be successful. Actually, from this study, we found that medium range of experience is successful because they know already how to treat patients back home. They see it here, they come back, and they can quicker implement this. They also have more weight in the department if they have experience. And also conference attendance was actually associated with the highest success score because observers, they get inspired by the conferences, they see talks, they see improvements, they come back home and they want to improve. So I'll show some separate slides for various organizations. So Peace and Development Foundation, they organized more than 175 observerships abroad. It's led by Rostislav Semikov. He's doing amazing work. Here you can see Harvard Hug GMKA, Scholars at Risk program, led by Dr. Poznansky, Hart, and Dr. Zmelnichuk. So you can see they organized more than 62 observerships for 24 specialties, 85 months of training total, mostly a Harvard-affiliated system. You heard the talk from Mark. It's amazing work they are doing. And this is the work of Doctors United for Ukraine from Andriy Zinchuk's group. And so you could see Yale University also organizing a lot of observership. This is the program from my group, Help Ukraine group. We affiliated with Stanford, so we organized more than 68 observerships in US, Australia, Canada. We are friends with Canada. And also we started observerships in Europe. As you can see, all these amazing institutions are training voluntarily Ukrainian doctors of various specialties. So in conclusion, our impact, more than 400 observerships organized. The observers overwhelmingly changed the perception of how to practice medicine. It's just very important because we want to get rid of the Soviet standards in Ukraine. They learned new procedures, implemented new procedures, provided peer training, but also they published more than 50 publications from our observers, which is quite impressive. In conclusions, because Mark already showed me end time, train-the-trainer model is an effective multiplier through knowledge dissemination, mentorship, continuity, initiation, new project. The key enablers are institution support, targeted matching, observership with expertise, and financial logistical facilitation is very important. We found that success scores were highest amongst more experienced professionals and those attending conferences, and this project can be really scaled to other LMICs in conflict settings. Now, our next steps, maybe we can discuss it more at the panel, expanding collaboration, and then increasing the professional participation. We train mostly doctors, but it's important to train allied health professionals such as nurses or therapists. So it's very, very important to provide this training. Thank you so much for all the partners and sponsors. It wouldn't be possible without the amazing work of all the organizers and hosting institutions and all the funders for sponsorship. So you could see some of the organizations they funded all these observerships. And I would like to thank the whole team from various NGOs and all the participants in this project. They dedicated enormous amount of time organizing this, thinking through every piece, every detail, and leading these projects. So thank you so much from the bottom of our hearts. Thank you for your attention.